Doctors today continue to try to reach the patients by phone after discovering they may have been exposed to the degenerative neurological disease Creutzfeldt-Jakob disease, or CJD. News 3's Linda Eggert in the news center now with the very latest. Linda.
Well, today UW hospital officials flatly denied any negligence was involved in this matter and said they plan no changes in how they sterilize neurosurgical instruments. That was the potential route of disease transmission here to the 53 patients who are now facing years of waiting and wondering.
Someone who we are notifying should not have cause to feel upset, worried, or concerned.
At a press conference today, UW hospital doctors first and foremost tried to reassure the 53 patients who've all had brain surgery during a recent 40-day period. Doctors have notified them that they have what they call an extremely low risk of contracting Creutzfeldt-Jakob disease, or CJD, a rare brain disease that's always fatal.
Our efforts are to reassure them, to let them know that this happened, that there is a very, very small possibility, but that there is no reason for fear, being scared, changing their activities.
At issue is whether the 53 patients were exposed to virulent infectious agents called prions via surgical instruments. That's possible because the instruments in their brain surgeries were also used to remove a brain tumor from a woman in her 50s who died Tuesday of CJD. Doctors didn't suspect she had CJD at the time of her June 11th surgery, so they didn't use disposable instruments or re-sterilize the instruments according to special federal CJD guidelines. The CJD case was finally confirmed at a national lab more than 5 weeks later after an earlier hospital test failed to detect it.
What they didn't see was the classic signs of CJD, which is the spongiform changes that would have led them to suspect it. Had they seen it at the time, it would have been, of course, notified of that, but that was not present there.
If there had been a suspicion that this was CJD, we would have used disposable instruments.
But doctors didn't suspect the woman had CJD, so regular instruments were used and reused after only the regular cleaning process. Now the instruments have been re-sterilized following those CDC protocols and put back into use. Now, some hospitals are different. Meriter, for instance, says it incinerates any instruments linked to CJD-type cases. Still, the UW hospital calls its process watertight.
So they say, Linda, the patient risk is low or virtually non-existent, but no one really knows for sure, right?
Well, that's right. Worldwide, there are only 2 known cases of CJD transmission through surgical instruments, but it can take decades for the symptoms to surface. So that's the key concern here. The ages of the patients that were notified are age 3 to 83, a large span.
All right, News 3's Linda Eggert in our news center tonight. Linda, thank you.
Thank you, Linda.